Hello, today we're going to do a presentation on type 2 diabetes. So to start off, what is type 2 diabetes? Type 2 diabetes is a chronic disease that is characterized by hyperglycemia or high blood sugar and caused by decreased sensitivity to insulin or impaired insulin production. Insulin is a hormone released by the pancreas that allows glucose or blood sugar to be used by cells in the body as a source of energy. Insulin also allows glucose to be stored as glycogen in liver and muscle cells and as fat in adipose tissue. And adipose tissue is our body fat. Glycogen is broken down into glucose when the body needs it. When the cells in the body don't respond to insulin properly or the pancreas isn't making enough insulin, glucose levels in the blood can continue to rise and cause hyperglycemia, which again is high blood sugar. Type 2 diabetes is typically caused by lifestyle factors such as obesity and inactivity. Some of the risk factors associated with type 2 diabetes include family history, being older than 35, having history of gestational diabetes, which is diabetes during pregnancy, prediabetes. Prediabetes is when you have a higher than normal blood sugar that is not diabetes just yet, but if left untreated, prediabetes can progress to type 2 diabetes. Being of African American, Hispanic American, Native American, Asian American, and Pacific Islander descent, having high blood pressure, and having high cholesterol. Okay, so here we have is a chart from the CDC that shows you your different blood sugar levels.
There are quite a few signs and symptoms that can point to diabetes mellitus 2 that may help providers reach conclusions as to what's going on with the patient. Some definitive ones include the signs, which are usually found in blood tests like an A1C. This is a blood test that observes how well your body's been processing sugar in the past 3 months. A1C above 6.5% is usually an indication of diabetes mellitus 2. There's also a fasting blood sugar test. This blood sugar is taken in the morning after a person does not eat overnight, and any value over 125 milligrams per deciliter indicates diabetes mellitus 2. There's also a glucose tolerance test. This test involves taking sugar levels 1 and 2 hours, sometimes 3, after consuming 8 ounces of a glucose solution. If at the 2-hour mark a glucose tolerance test reads more than 200, it usually indicates DM2. There's also random blood sugar tests. This is your normal daily finger stick test that you might witness other people, maybe in your family, perform on themselves to test their own blood sugar before meals. It's taken whenever there's not any fasting that's needed. It's just read as is, and a value over 200 milligrams per deciliter is usually indicative of DM2. As for symptoms, there's quite a few for DM2. These include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections due to that higher amount of glucose in the body. There's also something called diabetic neuropathy, which is numbness or tingling in the hands and feet. This is very, very like a hallmark sign of DM2, especially as the disease progresses. Another common symptom is areas of darkened skin, usually in the armpits and the neck.
Exacerbations. There is hyperglycemia, and this is when blood sugar is over 200 milligrams per deciliter. The onset is gradual. It can take hours to days. It can be caused by infection, stress, steroidal medication, skipping oral diabetic medication such as metformin, or not adhering to a diabetic diet. Some signs and symptoms that you might experience are polyuria, which is excessive urination, polydipsia, which is excessive thirst, polyphagia, which is excessive eating, hot and dry skin, slow wound healing, and vision changes. Treatment includes insulin as needed, exercise, and increasing fluids. Conversely, there is hypoglycemia. This is when blood sugar is less than 70 milligrams per deciliter. The onset is sudden. It can be caused by too much exercise, too much alcohol consumption, and too much insulin administered for your body's needs at the time. Insulin is usually not used in type 2, but let's say you get hyperglycemia and insulin is administered, then you might get hypoglycemia. Some signs and symptoms that you might experience are cool and clammy skin, sweating, palpitations, fatigue and weakness, confusion, headache, shakiness, inability to arouse from sleep that can lead to a coma. So treatment includes oral intake of 15 grams of carbohydrates, and that can be half a cup of fruit juice, half a can of soda, 1 tablespoon of sugar, honey or corn syrup, or 2 tablespoons of raisins. Then you want to recheck your blood sugar after 15 minutes, and if it's still low, consume another 15 grams of carbs. Hyperglycemic hyperosmolar non-ketotic syndrome is when there is an excessive amount of blood sugar, over 600 milligrams per deciliter. The onset is gradual, like hyperglycemia. It's caused by unmanaged diabetes, infection, illness, stress, impaired kidney function. Some signs and symptoms that you might experience are severe dehydration, which is due to the buildup of glucose in the blood, mental status changes such as confusion, hallucinations, drowsiness, weakness or paralysis. Treatment includes fluid replacement, correction of electrolyte imbalances, and insulin administration. This is typically more common in people older than 40 years old.
The steps to managing diabetes begins with coping with stress. Stress can raise your blood sugar. Learn how to cope and lower your stress. You can do this by deep breathing, meditation, guided imagery, or working on a hobby. Ask for help from a counselor or family member who will listen to your concerns. Another step to managing diabetes is eating healthy. Eating the right food can help manage your blood sugar and help you lose weight. Choose foods lower in calories, such as poultry and fish. Eat foods with more fiber, such as whole grain cereals, breads, crackers, rice, or pasta. Choose foods such as fruits, vegetables, whole grains, bread, and cereals. Drink water instead of juice and regular soda. And it is important to eat small meals throughout the day to help keep your blood sugar steady. Another way to manage diabetes is to stay active because it helps you lower your blood sugar levels. Regular exercise can also help you to reach and maintain a healthy weight, reduce the risk of diabetes complications, and get better sleep. For diabetes type 1 or 2, the aim is for at least 150 moderate intensity exercise each week. Diabetes-friendly exercise includes walking, swimming, dancing, or cycling. Talk with your doctor on ways to incorporate activity into your diabetes management plan. You may need to follow special precautions like checking your blood sugar before and after working out. Another important way to manage your diabetes is taking medications. If lifestyle changes aren't enough to lower your blood sugar, then you need to take medications. These drugs lower your blood sugar in a variety of ways. Alpha-glucosidase inhibitors, or acarbose, biguanides like metformin, DPP-4 inhibitors, glucagon-like peptides, meglitinides, SGL2 inhibitors, sulfonylureas, and thiazolidinediones. Take your meds even when you feel good. Ask your doctor if you need aspirin to prevent a heart attack. Also, you have to know what to do every day, like checking your feet daily for cuts, blisters, red spots, and swelling. And if there is, call your healthcare provider for sores that do not go away. Next, you have to brush your teeth and floss every day to keep your mouth, teeth, and gums healthy. It is also important to stop smoking. and check your blood sugar 1 or more times daily. And lastly, check your blood pressure if your doctor advises and keep a record of it.
As far as community resources go for San Joaquin County, the American Diabetes Association can give referrals for education and resources, as well as summer camps for children and teens, and informational and support groups. Centerplate is a local business that offers educational classes on diabetes, nutrition, and also offers exercises and dance classes. St. Joseph's Medical Center has 2 programs, the Diabetes Education Empowerment Program, which is a free 6-week course with hands-on and interactive curriculum, as well as the Sugar Fix program, which has information and support for the highs and lows of living with diabetes. Here is our reference page. Thank you so much for watching our presentation. I hope you enjoyed.